My eyes are getting smaller and smaller, which means it's almost time for bed. So we got one last question, and then I'm going to bed. Yeah. The question is from Jessica, but a different Jessica than the other Jessica question. Yeah. And yeah, this is also a Jessica who has asked questions before. Hello, how are you? Yeah, I hope everything's all right. Okay, so question is, how long after symptoms appear does it take for the virus to be detectable by fecal testing? Yeah, okay. We know that, and it pops up in fecal testing around the same time as it pops up in nasal testing or sort of throat swab testing. It seems to be very similar. I've seen tests of small numbers of people where it was like the same time when they could finally detect it in them. There are others where I thought it might have lagged a day behind um, nasal swab testing. But I don't know that that's everybody, and I may just be thinking of like one or two cases out of a big pile. Um, yeah, so it's still a pretty darn good method, but especially good for knowing when you're finally free of virus. It's the best method we have by far, by far, far, far. So, does the severity of disease make a difference? Interesting. Yeah. I have seen papers saying that the severity of the disease, let's see, predicts the amount of antibodies that you have. I've seen papers that I think were just speculating on it. The one paper where they actually measured the amount of virus in people that had mild, moderate disease, the numbers were kind of like all over the place. I think they came to the conclusion that there was a little bit more virus in people with severe disease. I could be misremembering that. But I don't think you can count on that. Like more virus being more disease necessarily. I think there's too many other variables there. Although that would be a good bet. If you have more virus, usually that goes with greater risk to health and life and more disease. Yeah, along the way. So, does fecal testing allow less room for error than nasal swabs? Yes. And fecal testing will remain positive and accurate long after a virus is no longer detectable from nasal testing. And this is not virus that, I mean, at first they were thinking these crazy things like it's virus that you just keep swallowing somehow, but it's no longer detectable inside your nose or mouth, but it's somehow just like being burped up from your lungs and cycling down, or it's shunting via some unknown organ directly from the lungs to the intestines. Yeah, which if you got an anatomy textbook, just point that organ out to me, and that'll be news. I'll go tell our A&P teacher. He'd like to know that too, I bet. But it turns out that it's just the virus infecting down in the intestines. And once it gets into at least the nose and throat, then it's very easy for some of that to be swallowed. Most of it probably gets destroyed, but it seems as though enough virus makes it through often enough that it's pretty reproducible. That if you have SARS-CoV up here, you will also have SARS-CoV down there. And so, yeah, it is a much better assessment method. It is a method that I really wish U.S. hospitals were using, and I wish that hospitals were doing that thing where you have to have two negative tests before you can be released, because that's how you be as careful as possible. The things we're doing are we're not even trying to do that. We're just trying to stem the tide and not completely collapse. That's kind of the way we're handling testing and treatment at the moment. And we're cutting corners, and yeah, we're messing certain things up. I think almost all patients in the US that are released from hospital are probably still COVID positive, because if they test anything, some places they only go by symptoms and then say, yeah, sure, go home, we need the bed for somebody else, which I understand. But even if they're testing just with the nose swab or the throat swab, they still would not necessarily pick up the virus, even if it was inside of there. And as long as you have the virus inside of you, the virus can come out of you and it can infect somebody else potentially. You can't take these chances if we're going to eradicate this virus. And I very much want to eradicate this virus. Yeah, I am fan number one of eradicating this virus. So, yeah, it would be lovely if fecal testing was more widely adopted. It would be lovely if we weren't treating testing as this burden that's being put, financial burden that's being put on the poor insurance companies, poor poor insurance companies. Yeah, yeah, by you, yeah, you COVID-ridden, yeah, miscreants, and treated this as something that is a national priority that is fundamentally important to not just the nation, nation first because we have more control there, but also eradicating this thing should be, I don't know, priority one, I think, for the entire world until it's gone, until it's dead. You keep your eyes on the prize and not take them off. And we're not even looking at the prize at the moment. And that's why America has so many COVID cases. That is one of many reasons why America is doing so very badly right now, which is not good. I don't like to see the country where I grew up just throw things away and fall apart because they don't want to do a good job, even though, yeah, we all know, well, yeah, you all know, and I know what a good job would look like. Yeah, so, oh well, yeah, I don't know. Gotta keep talking, talk to more people. You go out and talk to more people, convince them. Eventually, we'll get them convinced. I don't know. Maybe this thing will be over anyway before we get them convinced to do that. But that would be really good if we could actually try to do this on as large and inclusive a scale as possible and actually start to take the fight to the virus instead of just messing up and then reeling from the blows that the virus is dealing to us. Yeah, which is kind of where we are. So, anyway, it's my bedtime. I hope you have a good day, week, month, year, whatever. Yeah. Thanks very much. It was a good question. This is Ask Dr. Ben.